Hi everyone, my name is Dr. Alex George. I'm an A&E doctor and the UK's Youth Mental Health Ambassador. I'm also an ambassador for LloydsPharmacy. And in this video, we're going to cover what the flu is, how you catch it, what symptoms you get when you have the flu, who's most at risk, and very importantly, how to protect yourselves and others from this virus. Let's go. First of all, what is the flu? Well, this illness is caused by the influenza virus and is transmissible easily from one person to the other, usually through coughing or sneezing. So droplet infections, really. The symptoms usually last between 5 and 10 days, but can last a few weeks, and is usually characterised by the following symptoms: a headache, a fever 38 degrees Celsius and above, aching from head to toe, sometimes a runny tummy, sore throat, being off your food, not sleeping well, and generally run down. These are the common symptoms. I know some can be vague, but often you'll have a few of these all together. By nature, the influenza virus is extremely contagious. We know that patients are most likely to pass it on to others from day 1 of symptoms to day 7. Afterwards, it's less likely because your immune system has tackled the virus and you're not so likely to be infectious. The main modes of transmission of the virus are usually from coughing or sneezing. So typically people coughing into the hands, sneezing into the hands, touching surfaces where the virus can live for around 24 hours. That's then touched by other people, picked up, and they're infected with the virus. That's why it's so important if you're coughing or sneezing, you're trying to do that into a tissue and binning it straight away, washing your hands immediately after. That's the best way to prevent it being passed on to other people. For many, the flu can be a mild to moderate illness, but for some, it can be very serious indeed, causing complications such as sepsis and pneumonia. This is why it's so important that we protect ourselves. So what's the treatment for the flu? Well, most of it's actually supported. We rest, we eat well, and we sleep, and allow the body's immune system to fight the virus and build up that protection. If your illness is persistent or severe, if you're becoming very dehydrated, if you're not able to function and do your normal daily tasks, or that you're concerned, you should always discuss with the NHS on the 111 telephone line, get more advice, and if you need to, see your doctor for help. As the winter months approach, we know that people spend more time inside in close proximity, and therefore transmission of the virus is more likely, and that's why it's more important now that we keep going with the hand washing. Secondly, make sure that you're using a face mask when you're close to other people, particularly public transport and tubes, and also that if you're coughing or sneezing, you're using that tissue, binning it, and washing your hands afterwards. I hope this video has been useful. To find out more information, head to the LloydsPharmacy website or pop into your local store, and make sure you find out how to protect yourself and others from the flu this winter.